Okay, so we're here with Brandon. He came down here from Queens, New York. He's been struggling with arm pain, sort of this nagging numbness and tingling. His arm goes dead after throwing about an inning. Having trouble gaining velocity, but more importantly, can't complete more than a couple innings without having this nagging, gnawing pain in his biceps. It's really debilitating. So he came down for a Rocket Launchers training camp. We did his physical assessment, found a few things in there. His video analysis looked really good. There was really nothing that would indicate that he would be predisposed to having biceps pain. His arm action was clean. His lower half could use a little work, but he had a little bit of a linear deceleration pattern. We thought maybe if we fixed that, it would eliminate his biceps pain that he was having. We got him back for the day after the camp. He did the 5-day add-on, so he came to train for the first day. And after about 12 throws, he began to have that same sort of achy, gnawing feeling in his biceps there, accompanied by numbness and tingling into his hand. And so we did a few tests, and here's what we found. So basically we're going to do a test for thoracic outlet here. You can see that his hand is nice and pink and he's got really good blood flow to it. And I'll palpate his pulse right here. And I have a bounding pulse. And then when we take him up into the throwing position, the pulse is obliterated and his hand goes white and starts to blanch. And if we hold him here long enough, he'll begin to experience symptoms here. Now he hasn't been throwing today, so it's probably not going to be as irritable today. But when we do this test, what happens is he starts to have that same aching feeling in his biceps, and he gets some tingling into his fingers. And so, and then we bring him back down, and the pulse returns, and the color returns. And so we think that he has thoracic outlet syndrome. We're going to start a course of some physical therapy with exercises and some manual therapy. We're going to be doing first rib mobilizations, and to do that, I'm going to bring in our lead therapist, Dr. Pam Sandifer. She's going to come over here and demonstrate this. Come on in, Pam, and you can talk us through what you're doing.
All right,
Okay?
Go ahead and lay down on your back. Go ahead and take your hat off if you don't mind. The first rib, basically we're going to mobilize the first rib arm. So what we want to try and do is get it to loosen up a little bit. All the muscles around it get really tight, so we want to try and get those muscles to loosen up while we try and mobilize the rib. So what I'm going to do is put those muscles and take the tension out of them. So I'm going to bring his head over to the left a little bit. And that takes the tension out of the muscles that affect that first rib that make it difficult to move. And once I locate the first rib, go ahead and let your arm relax down by your side. There you go. Bring him into a little bit of side bending to the left. And once you find the rib, you're just going to make small little mobilization movements up and down to try and get it to loosen up. Bring him into a little bit more side bending. And then once I have him depressed, that first rib depressed a little bit, I'm going to bring him back into neutral, hold it, and then bring him back into side bending and mobilize it just a little bit more. Doing okay?
Yeah.
And we'll do it 3 times. Each time I'm giving about 10 small joint mobilizations, a grade 4. And then I'll do a little rotation. I'm going to take my pressure off, and then I'm just going to give him a little passive range of motion. I'm going to take the pillow away, and if you can scoot all the way to the edge of the table for me, so your shoulder is right there on the edge. I'm just going to stretch out his pecs a little bit. and bring him through a little bit of shoulder range of motion while depressing the first rib at the same time. Okay. All right. You're good.
All right. Good job, Pam. Thank you.
You're welcome.
All right. Good. All right, now, in addition to that manual therapy, what we're going to do now is we're going to go into our fitness fusion room, and we're going to have Matt Abramson, our Army Strong director, take him through some soft tissue work and some stretching exercises to try to create some space in there. Okay, so when we're talking thoracic outlet syndrome, what we're dealing with here is a compression of the neurovascular bundle right underneath the first rib here. So you got the subclavian artery and vein and the brachial plexus, and they're compressed under here in a place called the thoracic outlet, which is bordered by the first rib, the corticoclavicular ligament, the scalenes, and the subclavius muscle, and they get pinched off in here, and it creates those symptoms. You can have arterial symptoms, which result in decreased blood flow, which I think is what Brandon has. You can have neurovascular, you can have neurogenic symptoms where the nerve is compressed, the brachial plexus is compressed, and you can have a venous return problem too. So all those are issues that we're going to need to deal with, and we showed you the manual therapy. Now we're going to bring Matt Abramson in. He's our director of our Army Strong program, and he's going to show you the stretches, the mobility exercise that we do to try to create more space in that thoracic outlet.
Hi guys, Matt Abramson here. We have Brandon here, and the first stretch we're going to do with him is called the scalene stretch. So go ahead and grab the top of your head, and what he's going to do is he's going to pull his head down while depressing his scapula here. And what we're trying to do is create any space we can in this thoracic outlet right here. So he's just going to pull his head while depressing his scapula and his shoulder right here. That's called the scalene stretch. That's the first one. Alright guys, the second exercise we have for Brandon is called thoracic extension. What he's going to do is he's going to put his hands behind his head. And all he's going to do is he's going to take his elbows and his head, and he's going to retract them, trying to get a big stretch right in here. Again, we're trying to create any space we can in the thoracic outlet here. For Brandon, we're going to do about 10 to 12 reps, hold for about 3 to 5 seconds, come up, and then go back down again, give it a big squeeze at the bottom. That's called thoracic extension. Alright guys, the third exercise we have for Brandon is called the mid-trap exercise, and what he's going to do is his arms are going to be straight out on the side, and he's going to have thumbs up, and he's going to pinch up, really pinching with the scaps and raising his chest off the ground, holding for about 3 to 5 seconds, and then he's going to go back down, and we're going to go about 10 to 12 reps of this as well, just trying to create any space we can in that thoracic cavity, as well as creating some postural changes as well. Just 3 to 5 second hold, 10 to 12 reps, mid-trap exercise. Alright guys, the fourth exercise we have for Brandon here is called scapular squeeze. What he's going to do is he's going to turn around just to show you guys what he's doing. He's going to squeeze his scaps, depressing his shoulders and his scaps here, giving a really big squeeze right here. We're creating that space in his thoracic cavity once again. And what we want to make sure we're doing is we're not shrugging here, so we're really just pinching down here. And he's just going to go about 3 to 5 seconds, go about 10 to 12 reps. Big squeeze, opening the chest, pinching with the scaps right here. Alright, so the fifth exercise we have for Brandon here is called the no money stretch. What we do is we put a foam roller against the wall here. What we want is for his head and his lower back to be flat up against the foam roller. And what he's going to do is he's going to put his elbows at his sides, elbows stay connected to the body, and he's going to take his thumbs back towards the wall, squeezing around the foam roller with his scaps, and just coming back. So he's going to give a really big stretch when he gets out there, and he's going to come back. We call it the no money stretch because, as you can tell, Brandon's got no money. And we're going to go about 10 to 12 reps of this, give it a big squeeze right at the end. No money stretch. Last exercise we have here for Brandon is called the wall sit with arm slide. What he's going to do is he's going to put his lower back flat against the wall, head against the wall here. He's going to have his elbows and the backs of his hands on the wall, and he's going to slide up, bringing his hands on the wall. And then when he comes down, what he's going to do is he's going to squeeze his elbows to his ribs, and really squeezing in there, creating a big cavity for his thoracic spine, and then he's going to come back up. We're going to hold for about 3 to 5 seconds at the bottom as well, going about 10 to 12 reps on the slides. This is wall sit with arm slides.
All right, so in conclusion, this is what we're going to do. That pretty much sums up our conservative treatment for thoracic outlet syndrome. Brandon was just diagnosed by us yesterday, so I want to publicly thank him and his family for bringing him down here to allow us to work with him, and also being willing to share this and let us use this as an instructional tool here. But right now, so the next course of treatment is, you know, we mentioned that Brandon's from Queens, so he's a big Yankees fan, of course. And so he comes in his Blue Jays hat, and now he's going to see the Tampa Bay Rays team physician, Dr. Coco Eaton, in about 20 minutes. We got him an appointment over there. So he's really conflicted about his allegiance in the American League East. We're not sure how he's going to feel after he finishes with the Rays doctor, but he's headed over there to just get a definitive diagnosis and a future course of action from Dr. Eaton here in about 20 minutes.